Hi, my name is Liz Prehn. I'm a nurse here at OHSU in the South Operating Room, which is our adult inpatient OR. My role is I am what's called a specialty practice leader in that environment. It's SPL for short, and I live here in Portland, Oregon. Feedback is one of our nursing standards, and self-included that I get to ask for feedback. And I actually went to one of the nurses that was in the transition to practice program when I was the facilitator for that, and I talked with her. And what I heard her say to me was really interesting in that she was like, you know, Liz, she said, I came from this environment of ICU where I really felt like I needed to know the answers and have all my ducks in a row every day all the time. And she said, you helped me understand that sometimes I won't know, and how do I navigate that uncertainty, and how do I use my resources when I don't know, and when being able to recognize that in me. And so that was really interesting to hear back from her, in that when I think about my teaching philosophy and that idea of not knowing the answer, to have her reflect that back, I thought was really interesting. I've remembered one young man who was really struggling to identify like his role in the operating room, and meeting with him, and I think he was looking for like this really big traumatic or like spectacular thing that he was supposed to show up and do. And I was like, well, I asked this question back to him, does that mean that you don't do anything for the patient? And like I could see this light bulb go on where he was like, oh no, I do stuff for these healthy patients all the time, because he works in an environment where the patients are generally healthy but having surgery for whatever reason. After that, I saw a distinct difference in him, and it was like it wasn't what I expected, but I learned a lot in that moment too, how to engage with people and help them find their way.